Hello, so my name is Madison, and this is my senior capstone presentation. I decided to do an education project for the groin bleeding protocol from the unit where I work. So I am a cardiac med-surg nurse. I take care of cardiac patients who are not quite ICU level. So one of the procedures that we get patients back from is called an angiogram or a heart catheterization. And a heart catheterization, the patient comes away from the procedure with a puncture wound in either their wrist or their groin into an artery. And because these punctures are into an artery, they have a tendency to bleed, which can be a little bit concerning. And we have a protocol for bleeding sites that tells us whether we need to observe the patient, do some interventions, or advocate to send the patient to the ICU. And I decided to do educational materials on this protocol. So I entitled my project Bleeding, Oh No, Education on What to Do. So the situation that led to the idea for this project was a push from leadership to advocate for ICU transfers for patients who were unstable and had unstable groin sites. There were several incidents where patients had unstable groin sites and really were a higher acuity than what we could take care of. But because we weren't as educated on the protocol, it was hard to advocate and know how to push for an ICU transfer and how to really identify that line between stable and unstable to send the patient to the ICU. I recall hearing colleagues voice frustration on not knowing quite how to advocate, and I myself wasn't quite familiar with the groin bleeding protocol. I had a vague idea on what it was. I knew how to take care of a groin site that was bleeding, but I didn't myself know the line that was a stable bleeding site to an unstable bleeding site. And that seemed to reflect a lot in a lot of my coworkers. So why do we need to know? Why do we care? What's the benefit of educational materials on a bleeding protocol? Well, bleeding is bad. Bleeding needs to be controlled. And it's amazing. I tell my patient, it's amazing how much blood can come out of one of those little teeny puncture sites. They can bleed a lot, and it's not safe for patients to bleed. So, for safety and the best care of patients, we need to be able to know how to care for patients who are bleeding, what to do, and when they need a higher level of care than what we can provide. With that, there's the potential reduction for rapid responses as we can advocate early to send them to the ICU before there's a need for a rapid response, or in worst case scenario, a code blue. Um, Education can boost the confidence of staff as well so that they are able to advocate for their patients and really push when they feel that the patient needs a higher amount of help than what we can provide. So what we needed, I decided to create educational materials on the groin bleeding protocol. There's several different ways you can educate staff, videos, skills days, education, classroom days where you have like a teaching and a lesson. The one I decided to go with are skills pass-offs. Skills pass-offs on my unit are a folder with educational materials that you read through, and then you pass off questions in the back with someone who is approved by the nurse educator. So with the reason I decided to do a skills pass off rather than like a class day or a video where everybody comes and watches is because skills pass offs are personally driven. They are put out the way we do it on our floor, they're put out each quarter, and we pick the nurse educator and her experienced counsel, take several of them, decide what we need to learn that quarter, and leave them out. And for 3 months, they're available to for pass off. And by the end of the quarter, everybody needs to have done them. So when you have a break in work and you have a minute to do them, or you're coming in to work for another meeting and you have time, you can sit down, read through the materials, and then answer the questions, and then pass off the skill with someone who's approved to pass you off. So I created the skills pass-offs, the question in the back, and then I decided I needed something a little bit more because skills pass-offs aren't available all the time. They're put out once a quarter and they're cycled through, so the material isn't always available. So I created a flow sheet from the information in the skills pass-off, the education, for situational decision making. It takes you through step by step with yes or no questions, and it ends with what you should do. So it's a way to be able to decide whether you need to monitor the patient or whether you need to advocate for an ICU transfer when you don't necessarily have access to the groin bleeding protocol education. I also realized that we often send patients, overflow patients to other floors because we're full, but we still have cardiac patients coming in. So the cardiac catheterizations are one of our simpler procedures, so they're often the first ones to be diverted as they aren't as critical as some of our other heart procedures. Realizing this, I decided to create a pamphlet for other units to send to them when they have cardiac catheterization patients, so that if they have a groin site that starts bleeding, they have education on what to do, since that's not what they normally take care of. So how did I go about creating the educational materials, my research, my mentor? So my mentor was an education project, so I went to the nurse educator. She's the one that ensures that the staff on our unit is educated and up to date on the best practices and skills to be able to take care of the patients that we have, our patient population. She is also the one that creates the skills pass-offs, so she could look through and approve my materials and make sure they were appropriate, and she could help guide me on how to format the skills pass-off. I did, in my literature review, I found an article about medical students taking a class on hemorrhage, and it mentioned that with greater education comes a greater confidence that leads to a higher likelihood to act. So I wanted my education to be able to boost the confidence of my peers and myself to be able to advocate for patients who were appropriate for ICU transfer so that the patient could receive the best care possible. So I printed off and read through the groin bleeding protocol. It's a really great document, has a lot of good information. It's a little bit wordy and it's not step by step, which I feel like sometimes you need in an educational materials. When it's like a high adrenaline situation, you need to know, oh, I do this, then I do this, oh, this happened, I need to do this. Where the education aspect of the groin bleeding protocol is very informative, it's very well done, it's not step by step, and it's harder to remember in an adrenaline situation. I also went onto the resources that we have through Lippincott at the hospital and looked through those resources and looked at some of the articles on bleeding and how to stop bleeding and incidents of bleeding. I then determined what could be condensed and simplified and made easier to understand, and what aspects needed to be exact, like word for word from the protocol. My mentor also helped me with this. She marked some things from my first draft that needed to be edited, and kind of pointed out a few things that needed to be exactly word for word so that it was very clear and understood what was expected from staff from the protocol that the hospital has in place. I needed to analyze the effectiveness of the education, make sure that it was working, it was appropriate, people were understanding. So what I did is I did a pre-survey to kind of judge where people were in their education of the groin bleeding protocol before I gave them educational materials. So I created a survey and then sent a link for that survey through the staff communication app so people could take it at home. It was a short survey, it was only 5 questions, just kind of sent out to them. It was hard to get staff to be engaged, so I did send it out a couple of times, and I did smaller groups to try and timed them appropriately. So night shift I did it a little bit later, and day shift I did a little bit earlier to try and get them when they were least busy. And then my post survey to kind of gauge how well the education worked, I did a QR code that linked to a survey at the back of the skills pass off after the questions for the skills pass off. I did this in part for time management reasons and to help prompt people to do the survey as soon as they finish to get as many responses as possible. So my pre-survey data, I asked several questions about their understanding of the bleeding protocol and their confidence in sending someone to the ICU and kind of knowing what to do once a puncture site starts bleeding. For the most part, people knew how to take care of a site that started bleeding. And they were also really confident in asking for help, which I thought was great, and kind of reflected well on our culture that we have on our unit, that no one was afraid to ask for help if they needed it for a bleeding site. The breakdown seems to be from the training on what we're given to know how to stop bleeding, and the knowledge of when it crosses the line from a stable patient where we can take care of to an unstable patient that we can't, and how to advocate to send them to the ICU. There were a few yeses to these two questions, on what the bleeding protocol was and your confidence in sending a patient to the ICU. My hypothesis were these were the nurses that were the most experienced and had sent people to the ICU on multiple occasions. So the post-survey data showed that for the most part, everybody learned something. Most people learned the groin bleeding protocol. Their confidence in sending and advocating for a patient to go to the ICU was increased. And that the information was easy to understand. That was one of my goals, was that it was easy to understand, simplified to the point where you could easily remember it, but it still covered all the information you needed to know. So overall, the educational materials and skills pass-off were a success. So roadblocks and hoops I had to jump through along the way. So typically skills pass-offs are put out once a quarter and staff have 3 months to do them. For this project, I didn't have that amount of time. After creating and doing the pre-survey and then creating the materials and getting them approved, I only had about a week and a half to educate staff. So that was something I had to plan for, to be able to kind of help get as many people taught and responses as possible. I went in on my days off and I sat down and taught my peers one-on-one and went through the skills pass-off with them one-on-one. I actually ended up really enjoying this, especially teaching the newer staff members, because they could ask me questions and clarify, and we could have a good discussion on the bleeding protocol and some issues that we've had in the past, instances that have happened, some examples. And I really did enjoy kind of that opportunity to kind of step into the nurse educator role and kind of be able to help someone who wasn't as knowledgeable gain the skills and knowledge and confidence to be able to better care for patients who are bleeding from puncture sites. Staff participation in surveys and different things was kind of difficult. I had to sit down with my mentor. We had to brainstorm some ways, and she mentioned that even day to day getting participation in education is kind of difficult. People don't want to do more work than they have to, which I understand. So going in and working one-on-one was a way I was able to kind of prompt some more participation. I also sent things out a couple of times at different times during the day to try and catch people when they were least busy. Another issue I had was that my mentor had a very busy schedule. It's summertime. She had a couple of vacations. So there was some delay in getting certain materials approved to be able to teach staff. So to help with that, I ended up having to change my schedule and timeline and combine the post survey with the skills pass off education. So rather than teaching my peers and then having the survey the next week, I put the survey in the back of the education folder so that as staff read through the education, answered the questions, they could then take the survey right then and there. So that kind of helped kind of keep my timeline and let me be able to finish my project on time. So what I learned, what I think of the future and all those things. So I really enjoyed creating the educational materials. I really loved doing the research, reading through all the different educational materials that were available and thinking of ways to condense them and make them easier to understand, to find ways to prompt like recognition later on. One of the things I did was I underlined and bolded some of the sections, and I did things like, what do I do? Because I feel like that's a question that goes through your head is, well, what do I do now? And then another one was, it won't stop. Like the bleeding won't stop, now what? And I kind of wanted the education to follow that thought process so that people would think, well, what do I do? And then they read what to do. And so I kind of hoped that that would draw some connections in their brain to help later on and help them remember I also really enjoyed teaching my peers. In nursing school, I remember when learned about how we would be teaching patients and it would be a big part of our job. And I remember thinking, oh man, I'm just going to have to tolerate that because I'm not going to want to teach people. It's not my thing. And actually, I really enjoy teaching patients. It's one of my favorite parts of my job. I love explaining their conditions and helping them understand better, helping them understand their medications and kind of why and what we're doing. And that seemed to bleed over into teaching my peers. I really enjoyed sitting down with the newer graduates and like the newer nurses on our floor and really being able to kind of give them knowledge and have them understand and kind of give examples so that they can be better prepared to take care of their patients in the future. It was fun to kind of step into that leadership role, that nursing educator role, and really help people learn and understand. That is one thing that the nursing educator does. She not only puts out skills pass-offs and skills days, but if there's ever an incident where a staff member seems to not quite understand an aspect of the job, she'll personally sit down and kind of educate the person, make sure they understand so that they can provide the best care possible in the future. I am a little bit unsure about the administrative responsibilities of the nurse educator. That seems to be something I wouldn't necessarily enjoy. She's responsible for ensuring that all staff members pass off their skills and have all their education requirements met by the end of each quarter and the end of the year. And I feel like after having like to fight with kind of the staff participation aspect, I feel like that would be something that was be kind of frustrating to be the one responsible for that and kind of have to find ways to really engage all of the staff to learn everything by the end of the year. Overall, I really enjoyed this project. It was a great learning experience. I feel like I'll probably go on in some kind of aspect as an educator in the future. I really enjoy learning myself and then passing on that knowledge. So thank you.